Achieving an erection more than 4 hours is very much possible. However, this is an emergency. It's a medical emergency. So this condition is known as priapism. And how does this happen? First, you have to understand the symptoms. One of the symptoms is erection that is lasting more than 4 hours. And that erection is painful. Apart from being painful, the shaft of the penile tissue is usually hard, but the tip is soft. This condition has two categories. So the first one is ischemic priapism. So ischemic priapism occurs when blood flows into the penile tissue and it's trapped there permanently, okay? It doesn't flow out, meaning there is no oxygenated blood that will be coming in, and the deoxygenated blood in the penile tissue will be trapped there. So this is why it is very painful. This condition is common with people living with sickle cell disease. It is common with people who are abusing these drugs such as Viagra, antipsychotics, and cocaine. Okay? And then one thing about ischemic priapism, if it is left untreated within 4 to 6 hours, it might lead to permanent impotence. So it is very risky. How do we manage such conditions? So the doctor will try to aspirate blood from the penile tissue to reduce the tension, or they might inject some drug into the penile tissue to stimulate constriction of the blood vessels. The last resort now is surgery. And the other type of priapism is the non-ischemic priapism. So this occurs when there is a high blood flow into the penile tissue, but the flow is usually slow. The flow outside the penile tissue is usually slow. So this one is less painful compared to the ischemic priapism. So non-ischemic priapism is usually just monitored. So erections lasting more than 4 hours, they should be treated as a medical emergency.